All right, so thank you everybody for joining us this morning. We have a wonderful program consisting of talks by Dr. Lu and Dr. Buga. So two speakers from two different countries will be sharing about their experiences about who are approaching the end of life. And so I just wanted to say a few words first. This topic is really important because we have one of the largest populations of Chinese Americans here in LA County. We have 1.5 million residents who are Asian, and about a third are Chinese American. So we obviously find this topic very important. I wear a couple different hats. I am the Director of Clinical and Preventive Services at the LA County Department of Public Health. I am also a geriatrician at Harbor Uslia Medical Center. And last but not least, I'm also the co-board chair for the Chinese American Coalition for Compassionate Care. So obviously this topic is meaningful to me on many different fronts in it. And we'll be discussing about ways to improve communication with our patients who are identified as Chinese or Chinese American, in order to make sure that regardless of what culture or background they come from, that we address what matters most to them, and at whatever stage of illness that they have, to give them dignity and respect for the person, and connect across cultures. So I wanted to acknowledge our sponsors who made today's event possible. And at the platinum level, we have the K&W Family Foundation. Silver letter, we have China Wind Foundation, AARP. Bronze, we have SCAN and Coalition for Compassionate Care of California, and Copper, Santa Clara Family Health Plan. And we also have our list of collaborating partners that we also very much appreciate. So I will transition to our founder and executive director of CACCC, Sandy Chen Stokes. We'll be introducing our keynote speaker for today.
Hi, everybody. My name is Sandy Chen Stokes, and it's our honor to have Dr. Lu and all the panel and the speaker, Dr. Buga, to be here today at the City of Hope. Actually, we have been partnered with City of Hope since 2011. So it's been 13 years past. Now, Dr. Lu is from Beijing Tsinghua Chang-Gung Hospital, and I have a privilege to knowing him since 2016. And this month, actually end of last month, he came to California, starting his 2 weeks traveling, visiting, and speaking. So this is his second professional healthcare forum. So we are very honored to be able to partner with City of Hope. And Dr. Lu have a lot of experience working with end-of-life hospice and palliative care, even though he has another very important role as a pain management director at the Tsinghua Chang-Gung. He has so many stories to be able to share. We really benefit greatly for the past week. So without further ado, I would like to have Dr. Lu Guijun starting his presentation. Thank you.
尊敬的各位同仁，首先特别感谢美华创造这样的机会，也感谢希望之城搭建这样。
Thank you everybody for coming, and also thanks City of Hope to giving me this opportunity to do this presentation and share with everybody.
作为中国的一位安宁疗护专科医生，特别希望世界能
As a
听到我们的声
Chinese
音。
hospice doctor, and I especially hope that I can take care of my patient.
那我知道在洛杉矶有很多华人也在接受各种医疗照护。
I understand a lot of patients in Los Angeles area are being taken care of.
但愿今天的内容能为从业安宁的医护人员和患者提供一些帮助。
I really hope that my speech today can benefit a lot of people, helping the provider to provide better cares for the patient.
那欠妥之处呢，希望各位同仁多多指正。
And if there's any suggestion or comment, I really welcome them, please.
今天我想聊一聊对于中国大陆的安宁疗护要注意的10个非常重要的内容。
Today I talk about the 10 things that we really need to emphasize in hospice care in China.
那为了协助各位对中国文化理解，每一个内容我都配备了一个临床故事。
So this is a lot of story that I have experienced and I want to share with you.
那我的内容就是安宁十戒。
The topic of my speech today is the 10 don'ts of palliative and hospice care.
在中国呢，我们每年死亡人口大概是1000万左右。
So in China, about 10 million people die each year.
比如说这一组数据，在中国2019年大陆死亡人口998万，2020年996万，平均每天呢大概有27800多人告别世界。
So you can looking at the statistic on this chart in 2019, there are 9 million people die every year, and the number just keep going up.
其实对于安宁疗护来说，我们认为症状管理是基础，人文照护是主线。
So for hospice care, we really think that we really need to focus on the comfort patient symptoms, and that's the key things that we want to focus on.
一个患者走到生命尽头，如果他身体的不舒服症状没有得到很好控制的话，那他的生命质量不可能得到有效提高。
So if the symptom is not well controlled, the quality of life for the patient, there's no way that we can elevate it.
在中国背景文化下，每一个人告别世界大概需要2个基本条件。
And I think in China, when patient passed away, there are 2 key elements that we need to focus on.
第一个是临终的时候死的时候像个样子，
First is to die with a dignity.
一种坦然平静的死亡。
It has to be a very calm and peaceful death.
第二是病人在临终前所有的意志和选择得到了尊重和合理的回应。
And also at the end of the life, patients' wishes are well respected.
所以我们经常也说，一个好的死亡一定是给了患者更多的选择方式。
So I always say a good death for the patient means that the patient has more choices of their own.
下面我就开始分享10点重要内容。
So then following, I'm going to start the 10 don'ts that I want to emphasize.
之所以称为10戒，是因为这10点是一定要严格的引起重视，并尽量避免的。
The reason why I say this is the most important 10 don'ts that we really need to focus on this and make sure that we follow it strictly.
第一是无视症状的临床。
The first one is overlook the clinical symptoms of the patient.
在这儿我有一个案例，是2013年3月份的一个病例。
Here I have a example that I experienced in 2013.
一个47岁女性患者，卵巢癌终末期。
There's a female patient with ovarian cancer at the end of stage.
因为病情沉重，她无法到医院就诊。
Because she is so sick and she couldn't come to the hospital to seek help.
她的弟弟找到我说：“陆大夫，你一定要帮忙我们的家庭。”
So her brother come to me and say, Dr. Lu, you have to help our family.
我姐姐是肿瘤终末期患者，昨天她求我说，等一天我告别这个世界之后，一定要在我坟上种一棵树，给树挂一个牌子，起名叫无痛。
So my sister told me that after her passing, you need to plant a tree, and on the tree hang up a plaque and saying no pain.
他现在痛不欲生，作为他的弟弟，我没法帮他缓解疼痛，而是要在坟上给他种一棵树，这一点让我非常痛苦。
So when the brothers come to ask me, he did not come ask me for the pain relief for his sister. Instead, her sister asked the brothers to plant a tree named No Pain.
他这种疼痛常规口服药不能取得很好的效果。
with regular routine pain management is not achieving the efficacy that we want.
我把他收住院以后，很快静脉泵上吗啡以后，疼痛很有效缓解。
So after the patient was admitted, we use a IV pump to pump in morphine, and the pain was well managed.
这个时候我问这个患者，你还需要在自己坟上种一棵树，并起名叫无痛吗？
So after the pain is controlled, and I asked the patient, so do you still want to plant a tree and with a plaque called No Pain on your gravesite?
他说我依然需要，因为疼痛毁了我一生。
And she said, yes, I still want that because pain has ruined my whole life.
我从小家庭生活优越，学习成绩很好，工作以后要获得各种奖项。
I have a smooth life all my life, always the top performer of the school. I got a lot of awards.
但是得病以后走到现在，疼痛让我痛不欲生，蓬头垢面，毫无尊严。
But after I got sick and the pain ruined my life, I everything is destroyed and give me no dignity whatsoever.
每天生活在衣不遮体、痛苦哀嚎中。
Every day, I am poorly dressed, just with the hospital gown and uncapped. I am really miserable.
所以疼痛毁了我的生活。如果人生是一本书的话，我这本书序言、中间章节都很好，唯独最后几个章节几乎无法提笔书写完成。
So if my life is like a book, and then I will say this book will be very well written throughout the chapter, but the last chapter ruined the whole thing.
所以我想用种树挂牌子的方式提醒世人，疼痛对一个中末期患者有多重要。
That's why I want to plant a tree and let everybody know how pain can affect one's life.
第二届缺乏人文的照护。
The second don't is to provide the kind of care that lacks humanity.
这是去年的一个老年患者，肿瘤中末期，从 ICU 转到了安宁疗护病房。
So this is a patient I care for, was transferred from ICU to my hospice unit.
ICU 好。
So I was telling her maybe our environment monitoring system is better than the ICU.
他说你们这条件比 ICU 好10000倍。
Yeah, but then the patient tell us that yes, your environment is much better than the ICU.
他说你们监护室的医护人员就像苍蝇蚊子一样。
In ICU, the nursing staff and the medical staff are like flies and mosquitoes.
我说我们应该被称为天使，你为什么这样说呢？
And then the nursing staff in my hospice unit should be called the angel.
他说我所在那个监护室大概有10几个病人，我们每一个病人就像一块腐烂的臭肉一样。
So in the ICU unit, there were about 10 people there, and to me, I feel that all those patients like rotten tumors there.
我们手脚被束缚在捆绑在床上。
So we are all bounded, tied up.
一旦哪个床上有报警声，医护人员像苍蝇蚊子一样轰轰飞了过去。
Every time when the alarm sound out, and the nursing staff will rush to the patient's bed like the flies.
经过一番盲目，报警声消失以后，他们也四散开来，回到各自位置。
So after the alarm is disarmed, and then all the nursing staff will go back to their own spot.
他们和我们没有任何交流。
There's no communication among us.
在他们眼中，我就是一个会喘气的瘤子。
To them, I am just a breathing tumor.
一个毫无价值、即将腐烂的臭肉。
It's a piece of rotten meat that's gonna be bad and but it's breathing.
由此可见，人文对一个重症患者有多重要。他们都在
that shows how important humanity is important to the patient.
他们都在极力维持自己身体的完整 和自己的抉择被尊重。
They really want their wishes and their requests be respected.
他们太需要医护人员和他主动的进行人文交流。
They really need nursing faculty to communicate them with humanity.
第3戒是施与敬畏的沟通。
And the third dome is communication without respect.
作为安宁疗护医生，一定要对生命充满敬畏。
Doing end-of-life care, we really need to maintain reverence for the life.
否则，再好的医疗照顾也无法赢得患者的认可。
Otherwise, no matter how good the care that you provide, you still couldn't get the patient's consent.
有这么一个案例。
I have a case.
一个患者住在医院的旁边，自从这个医院成立，他就在医院做志愿者，做了10几年。
I have a patient who lived by the hospital ever since the hospital is built.
有一天，患者罹患肝脏肿瘤，到医院就诊，需要住院。
So one day, unfortunately, the patient was diagnosed with liver cancer and needs to be hospitalized.
他委婉地向对他负责的医生表达，我在你们医院做了10多年志愿者，希望能得到你们的关照。
So he timidly asked the provider, said, I've been volunteer for this hospital for 10 years. Is there any way that you can help me to get a bed so I can be hospitalized?
我们大夫瞪大眼睛问他，这个有用吗？你告诉我这个有多大用？
But the doctor's response at that point was staring at him and say, do you really think this is going to help?
最后这个患者住进了我们医院的安宁疗护病房。
Later on, this patient finally got admitted to our hospice unit.
经过很长时间的交流，建立了关系。有一天，患者问我，陆大夫，为什么我做了那么多，竟赢不得你们医护人员的尊重和敬畏？
So we try all kind of communication, and through a long conversation, finally the patient opened up and asked me, say, Dr. Lu, I have done so much. How come all the work that I have done was not respected?
当时那个大夫一句“这个有用吗”，几乎毁了我一生的信靠和仰望。
So when the previous doctor told me, say, do you really think this is gonna work? Just by that simple phrase, ruining my whole faith in humanity.
第4戒，无关灵性的抚慰。
And the fourth stone is to meaningless comfort.
我想灵性就是一种无师自通的一种心灵感应。
I think spiritual needs is everywhere, and so we really need to respect it. And so it's not just a religion. We need to respect each one's spiritual need.
记得曾经我们病房收了一个86岁老年女性患者。
I remember that we once have an 86-year-old female patient.
住院之初，因为病情严重，认知障碍，无法和患者进行有效的沟通和交流。
When she was first admitted, because she was in a confusion stage and could not communicate with the medical staff.
经过初步治疗，患者病情稳定。
So after the initial treatment, finally the patient becomes stable.
此时交流已经没有障碍，我们的医护人员发现这个老奶奶留了将近2米长的头发。
So the patient become alert, and we have no communication issue, and we notice that the patient has long hair that measure to 2 meters long.
照护者非常委婉的问这个老奶奶：“你的头发可以为你剪掉吗？那样方便护理，你自己也会很舒服。”
So the nursing staff kindly, gently asked the patient, is it possible for you to cut off the hair so that way it's easier for us to care for you?
这位老奶奶严词拒绝，并不允许任何人再碰她头发。
So the lady say no firmly, and ever since that she will never let anybody to touch her hair.
有一天我去早班查房。
One day when I was doing my rounding.
我问这个老人家，我说头发留这么长，一定有故事。
So I asked the old lady, I say, you have such long hair, there must be a story behind it.
她瞬间面色非常和蔼地告诉我。
So she starts smiling. The expression on her face changed dramatically and start telling me the story.
1956年大学毕业，一个年轻帅气的小伙子喜欢上了我。
In 1956, when I graduated from college, a handsome young man started paying attention to me.
他喜欢长发妹，
He loves girls with long hairs.
我们两情相悦，走在一起，一块儿生活了50年。
And later on, we got married and we lived together for more than 50 years.
由此我知道这个老奶奶为什么如此爱惜她的头发。
From that point on, I understand why this old lady treasures her hairs that much.
当生命尽头，当有一天病情进一步得到好转，
So when life get to the end, what's meaningful to their life is even more important.
她告诉我她希望回家。
She told me that she wants to go home.
她告诉我，陆大夫，你让我回去吧，我的老头儿见不到我会想我的，他想我又见不到我，他不爱我了怎么办？
So she was telling me that she wants to go home, and she was telling me that I need to go home because if I don't go home, my husband won't see me, and by him not seeing me, what if he doesn't love me anymore? What should I do?
我们从来没有这么长时间分开过，现在他来医院很不方便。
We have never been separate for so long. It's inconvenient for him to come to the hospital.
我告诉这个老奶奶，虽然你现在感觉相对舒适，但是你的病情依然复杂，回去以后无法保证您的安全。
I told the lady that even though you feel you're stable, but your disease is still very complicated. If you go home, we cannot make sure that you will be safe.
这个老奶奶再次求我，你就让我回去吧，因为回家比什么都重要。
So the old lady keep begging me, say, to me, going home is the most important thing than anything else.
那后来我知道，这个老奶奶回家之后，告别在了老伴儿的怀里。
So later on, I found out that the lady passed away in her husband's arm.
我想，生命尽头，再好的医疗也无法比拟相爱的人拥在一起。
Make me realize no matter how good the medicine can be, it cannot be compared to be dying in in your loved one's arm.
安宁第5戒，一厢情愿的介入。
And the fifth don't is to we shouldn't be doing one-way wishful intervention.
我想每一个病人告别世界的内心的哀伤，
I think everyone has their own way to express their grief and toward the end of life.
他的亲人亲人即将离世的内心的伤感，一定是一个私密情感。
So the sorrow they have toward the death of the family member is very private.
这种离世的悲伤和丧亲的哀伤，不是你想帮忙就可以直接介入他的家庭。
These kind of bereavement sorrow is not something that you can interfere, and it's not something that when you want to interfere that you can interfere.
首先我们一定要通过个人努力让他接受你。
First, we really need to work hard to make sure that the other side can accept your counseling.
在中国有一句话，如想建立关系，我们说满腔热忱在于脸，一腔热情在于眼。
So there's Chinese saying that there's a different way to be helpful to other people.
这个图片呢，是我们请到了北京中央戏剧学院一个导演，教我们全部团队人员做表情管理。
So this picture is that we invite an instructor for the Chinese Art Academy to teach our staff how to show our expression on our face.
我们希望我们的团队人员通过很好的表情管理，让患者尽快能读懂你的真诚，接受你，融入他的生活。
So we hope that we can learn how to express our sincere heart to help patients, so that can help the patient to accept us and allow us to help them.
因为只有读懂他的生命故事，才能给予他个体化的好的一个告别。
So only when we can fully understand patient's story, then we can provide the best way to leave this world.
所以我们总结，安宁疗护要切忌一厢情愿介入。
So that's why we conclude that for hospice care, we can never do one-way wishful intervention.
面对患者和家庭，我们一定要做到真听、真看、真感受，才能真陪、真伴、真妥帖。
So that's why we come to the conclusion that in order to have a good rapport with the patient and the family, we really need to listen, we really need to look and truly feel for it. And then we can provide a true companionship, and then also we can act from our heart and with appropriateness.
那大家看到的图片就是我们这个表演系老师教我们表情管理的现场图片。
So the picture that shown here is how the instructor was helping us how to express our true feeling.
第6届是没有回应的心愿。
And the 6th stone is wish without response.
我们希望每一个临终患者在得到医疗照护时，他所有的心愿和想法都有回应。
We want to be able to respond to all the expressed wishes from the patients.
虽然我们不一定完全能帮他呈现，但是一定要有合理的回应。
It doesn't mean that the respond doesn't mean that we gonna fulfill their wishes, but we need to respond for sure.
图片中这个病人是湖南的一个患者。
The patient in this picture is a patient from Hunan.
有一次我去湖南开会，当地的医务人员在接我去开会的时候问到我一个病例。
So when the medical staff picked me up and take me to this case and was telling me about it.
他说：“陆老师，你一直教我们要完成患者心愿，让患者走的时候了无遗憾。”
Dr. Lu, you taught us that we need to fulfill patients' wishes, so when the patient passed away, they will have no regret.
但是很多患者的心愿是我们无法完成的。
However, there are so many wishes of our patients cannot be fulfilled.
此时此刻，正是因为读懂了他的心愿而无法完成，所以说我们都害怕见这个病人了。
Because we know the wishes cannot be fulfilled, medical staff becomes so scared to see the patient because we cannot provide any kind of response.
比如这个患者，当他住进医院，身体得到充分照顾之后，
For example, this patient, when he was admitted and he was fully cared for physically,
他告诉我们所有人，他最大的遗憾是他的弟弟40年前离家出走，到现在依然没有找到。
so he told us the biggest regrets that he had is that his younger brother left home about 40 years ago, and that they were never able to find him.
这是他人生最大的遗憾。
That's the biggest regret in his life.
而且他还告诉我们，20年前他的父亲离世，就眼含热泪告诉他：“你一定要找到你弟弟。”
And he even told us 20 years ago when his father passed away, his father in his deathbed and keep telling me that you have to find your brother.
他说：“我的父亲因此死不瞑目，我的人生也因此不会完整。”
Yes, because my dad left this world with this regret. If I couldn't find my brother before I die, I will go with regret too.
负责他的照护人员告诉我：“陆大夫，我们的工作本身特别忙，他40年没找到，我肯定也无法短时间内帮他找到弟弟。”
So the medical staff was telling me, say, Dr. Lu, you know our medical daily day-to-day work is so busy already. There's no way that we can spend more time to help him find his brother. Besides, he hasn't been found for 40 years. What can we do?
所以我们现在情况是，每一个人都特别怕见到他，因为我们完不成他交给我们的任务。
Well, that's why all the staffs are so afraid to see this patient because we know we cannot fulfill his wishes.
我说你们这样做似乎欠妥，或许你该直接告诉他，我会帮你找，但是我不敢保证短时内找到。
I told the staff, I don't think this is the best approach. I think you should tell them, say, we will try our best, but however, we cannot guarantee you that we will find him.
另外我说我有另外一种小经验，或许值得您借鉴。
And then there's also some suggestion I will make, and maybe you can give it a try.
我曾经遇到过几户和这个同样的一个病例，临终前他也想见到他找不见的亲人。
I have experienced a similar kind of cases. One patient was really trying to find the relatives that he couldn't find.
我说你现在找了这么多年没找见，或许你的亲人已经到另一个世界去了。
So I told them that you haven't found your relatives in this world for so long. Maybe your relative has gone to the other world already.
你的病情到现在也很快要告别这个世界。
And with your condition, you will say goodbye to this world pretty soon too.
接下来没准在另一个世界你会和你的亲人相聚，或许在另一个世界会找到。
Who knows? When you go to the other side, you may find your relative over there, or you may run into your relatives.
那我在这个世界也帮你留意，如果我找见了，我一定想尽各种办法告诉你。
And so if you go there and find your relatives, and on this side of the world, I will try to find your relatives too. If I find them, I will try every way and to let you know.
第7戒，切记大师风格的训诫。
And the 7 don't is never reprimand as a master.
每一个患者活到生命尽头，他不断在考虑死亡世界，他几乎成为了自己的生死哲学家。
At the end of life, everybody will focus on their life. It seems like everybody become their own philosopher.
所以此时此刻的我们照护者，我们只是需要倾听，而不需要那种大道理的训诫。
So at this time, most of the people, what we need to do is to listen more attentively, comforting, and definitely no master style reprimanding.
2017年，我曾经参加了这么一件自杀事件的干预。
2017, I was involved in intervention of the suicide.
一个患者住院7天后割了腕动脉自杀。
One patient after was admitted and he slipped his wrist to commit suicide.
患者的家属无法理解，找到医院负责人质问为什么会出现这种情况。
Patient's family couldn't understand why the patient wants to commit suicide and questioned the hospital staff. So, how can this happen?
医院的领导很重视，派了技术最为娴熟的医护人员，特护照顾他。
So the hospital really pay attention to this matter and have a special nurse accompanying the patient all the time.
但是这个患者拒绝和所有人交流。
But the patient refused to communicate with anybody.
他们找到我，希望我能帮上忙。
So they come to me and hoping that I can help them.
几次接触以后，和老人家建立关系，我问他你为什么这么选择？
So after I try to communicate with the patient, I try to establish the relationship with them. I ask him, why do you want to do this?
他说那才是我想要的。
He said, that's what I want.
我说你愿意告诉我背后的原因吗？
Can you tell me the reason behind it?
他毫不迟疑给我说出3个原因。
He told me without hesitation, there were 3 reasons why he wants to do that.
得病2年来，看了很多大的城市，病情最后依然重了又重了，现在上厕所吃饭都无法自理。
So ever since I was sick for the past 2 years, I've been seeing so many doctors at so many different hospitals, so many different places. My situation just got worse and worse, and now I can't even go to the bathroom on my own or feed myself.
我不想成为所有人的负担。
I don't want to become a burden for everyone.
第2点，得病2年来，疼痛如影相随，日夜相伴，让你一刻都不得松懈。
And the second is ever since I got sick, the pain is there day and night, and it's getting worse. It never disappears.
实在是难以忍受。
It's really hard for me to tolerate.
第3点，得病2年来，除了医保费用，自费花了几十万。
And also, because my medical care, besides insurance pay for it, I still spend tens and thousands.
我的姑娘和儿子对我特别好，他们家庭不要，工作不要，全身心照顾我。
My son and daughter are so good to me. They don't care about their own job or their own family. They just care for me wholeheartedly.
关键我这个病是治不好的。
But the thing is, my disease is not curable.
只要我活着，我会拖垮我这个大家庭。
So as long as I'm living, I am dragging the whole family down.
所以只有我走，他们才会安下心来过自己的日子。
So the only solution for this is I pass away, then they can continue their normal life.
那我告诉他，既然你们医院请我来和你谈话，我想我有一定的决策权。
So I told him that since you asked me to come talk to you, so I think I have some suggestion and decision that we can make.
你看我们这样做，你是否可以接受？
Let's discuss about this. If we do it this way, whether you can accept it or not.
现在我们特别复杂的有创伤治疗不再做，只是给你镇痛。
So how about we don't use expensive medication, but we just focus on your pain management and making sure that your pain is well controlled.
它第一不会让你痛不欲生，第二不会消耗你太多的经济费用。
By doing it this way, that we can control your pain but not causing too much to create financial burdens for your family.
平时我们的医护人员照顾你，等你需要的时候才叫你的子女来。
And also let our staff to take care of you, and only when you want to see your son and daughter, we'll let them know and ask them to come see you.
这个老人家说：“谢谢你，如果你们能做到这些，我愿意和你配合。”
So after hearing this, the patient is so happy and saying, if you can do this, I will definitely work with you.
最后他告诉我，我希望你能读懂我的世界。
Finally, he said, I hope that you can understand my inside, my heart.
如果你不了解我内心的痛苦，你无权要求我在这种非人的酷刑中度过余生。
So if you cannot understand my true feeling, and then there's no way that you could take care of my physical need.
第8届远离现实的成全。
The eighth one is unrealistic assistance.
那首先我要介绍一点，在中国没有安乐死和合法的医助死亡。
So I just want to first emphasize in China, euthanasia and also physician assist that is not legal.
而且在中国没有完善的家庭医生制度。
And also in China, the family doctors healthcare is not well established.
在19年有这么一个案例。
In 2019, there's a case.
报纸的题目这样写的：父亲在儿子协助下自焚，死亡本不该如此惨烈。
So the case is a son helped his father to commit suicide. So it shouldn't be so sad.
福建三明市81岁老人陈水星因为疼痛难忍，产生寻死意愿，逼迫常年照顾自己的儿子陈贵平想办法帮其解脱。
So there is a 81-year-old man because the pain is so unbearable and wants to seek death. So he forced his son, who has been taking care of him so many years, and help him to die.
陈贵平迫于无奈，将病重的父亲带到一座废弃的寺庙，用被子将父亲裹好，在被子上浇上汽油，将打火机交给自己的父亲后离开。随后，患者陈水星自焚身亡，他的儿子陈贵平被抓。
So because the son needs to follow his father's wishes, so he took his father to an abandoned temple and wrapped the father in the blanket and pour gasoline over the blanket and give his father the lighter and left. After the son left, the patient himself lit the fire and burned himself to death. So afterward, the son was arrested by the official.
半年后，这起案件开庭审理，公诉人法院认为陈贵平涉嫌故意杀人，但主观恶意较小。
So 6 months later, the son was in court, and they judged him that he did intentionally perform the manslaughter. But we can understand that he doesn't mean harm because he was just following his father's wishes.
法院认为陈贵平主观恶意较小，建议 适用缓刑，判3缓5。
So they have the court has give him on 5 years parole.
事后我曾经问过这个法官，法官亲口告诉我，这件事从感情上我非常同情他，但是从法理上是绝对不允许的。
So after this case, I discussed it with the judge. The judge said, I can feel for the son, but from the legal point of view, this is not acceptable.
所以说，我们作为安宁疗护从业者，我们同情那些病中的患者，但是如果法律上没有允许的话，一定要做符合法律工作的事儿。
So as a hospice doctor, we can understand the patients why they want to do this, but they still need to follow the law.
我们照顾患者施予人文，但是要维护法律的尊严，在当地没有法律保障的同时，还要再想想其他办法。
So we care for the patient, but we still need to follow the laws and at the same time respecting patients' dignity.
第9戒，不被尊重的尊严。
The ninth is the dignity without respect.
在中国，所有的患者死去之后，他的遗体在运出医院的时候，必须走一个五五梯。
So in China, there's strict rule about transporting the remains of the patient, and they can only go through an elevator labeled with dirty waste.
那我知道，所有人即便自己去世之后，也不希望被社会上的工作者和亲人把自己的遗体当垃圾处理。
But I'm sure that everybody in the world, no matter living or dead, you don't want the body, no matter it's your own or your family members, to be treated as garbage.
发起了一项运动。
That's why I has promoted a movement in China.
这个电梯运送垃圾的功能可以不变，
The function of the elevator doesn't need to be changed.
但是如果有去世的遗体经电梯转运的时候，
But when we are transporting the remain of transporting the body,
我告诫所有医护人员，是否可以在电梯旁边挂一个牌子，给它命名叫云梯或者天梯。
So I suggest that maybe that we can cover the heading of the elevator instead of the dirty waste elevator. We can label it as a heavenly elevator or elevator to the heaven.
那有一个医院听了我的建议，做了如此改革。
So one hospital carry out my suggestion.
1个月后，他的病区主任给我发了一个照片，就是旁边那个照片。
So 1 month later, and the church in charge nurse sent me this picture. That's the pictures on the right.
一个患者当他妈妈离世之后，他在电梯外跪拜。
So after the patient, which is this lady's mom, passed away, and she was kneeling down at the elevator and show respect to her mom.
他告诉我，2年前我父亲去世是被当作垃圾一样处理的，而我妈妈去世是走的是天梯。
So she told me 2 years ago when my dad passed away during pandemic time, my dad's body was treated as garbage. But today my mom passed away. She is going on the elevator to heaven and ascending.
第10戒，未被理解的信仰。
And the 10th stone is a belief that is not understood.
我想每一个人心中的信靠和仰望对他至关重要。
I think to everybody, their belief and their is really important.
我见到一个患者，他因为肝癌、肝腹水肚子非常大。
I've seen a patient because of the liver cancer has really bad ascites.
因为他压迫胸腔，所以患者不能平卧休息，一直在端坐。
Because the fluid has so much fluid in his abdomen, he couldn't breathe, so he always sits.
我问他的主管医生为什么不做引流？
So I was asking the attending, how come you don't do any paracentesis?
主管医生告诉我，可怜之人必有可恨之处，我们可以帮他，但是他拒绝我们给他做这个治疗。
The doctor told us that we already suggest him so many times, but he refused to receive this kind of treatment.
我再次问患者，你为什么不同意做引流？这样你可以舒服一些。
So I went to talk to the patient myself and say, this by doing the paracentesis, you're going to be much more comfortable. Why don't you want to do it?
他说我的病你们肯定是治不好的。
The patient said, I know my disease is uncurable.
我不想在我死之前在肚皮上打个洞。
I don't want to punch a hole when I'm going to be dead.
我不想死后身体带一个洞去见我的父母，他的父母已经在几年前离世。
I don't want to have a hole on my body when I pass, because my parents has passed away a few years back. I don't want to have a hole when I go see them.
在中国有个朴素的信仰，人一生要完整的来，完整的去。
The Chinese believe there's always a belief that you come as a whole body. When you pass away, you have to go with a whole body.
那我告诉他，我们即便给你引流，会给你最后缝合好的。
So I told him, let's do the paracentesis for you. Afterward, we'll sew the hole together.
他非常吃惊看着我，他说：“如果是那样的话，我接受。”
So he was surprised to hear that and say, if you can do it this way, then yes, I will proceed with the drainage.
那最后确实他也在舒适中告别了这个世界。
So at the end, he left the world comfortably.
那最后总结呢，我想说，到底什么是安宁疗护？
So at the end, I want to say what I would like to say what is hospice care.
我认为安宁疗护就是当一个生命走到尽头，我就像一个渔夫一样，我摇着橹陪您出海，为生命撒下最后一网，尽可能让每一个生命满载而归。
As a hospice care provider, I feel that I am like a fisherman. When all that is left in life is the afterglow of the setting of the sun, I would like to roll the roar and accompany you to the seas and cast one last net for life and let every life be fulfilling as possible.
以上就是我的内容，感谢各位的时间，谢谢您的聆听。
So this is my presentation, and thank you for your time, and thank you for listening.
Thank you so much for giving such a heartfelt talk and sharing your experiences. I wanted to just put up a slide showing his extensive list of experience that could not be captured adequately in a brief introduction, so that everybody can see that he's an expert in pain management and is on many committees in China. Moving on, I would like to introduce our next speaker, who is Dr. Sorin Buga. He's a clinical professor in the Department of Supportive Care Medicine, where he serves as program director for the Fellowship in Hospice and Palliative Medicine and as a representative in the National Comprehensive Cancer Network Adult Cancer Pain Panel. And so he will be sharing the perspective from the US side.
Good morning, everyone. Dr. Chang, thank you for the lovely introduction. I think my relationship with the Chinese American Coalition for Compassionate Care, CACCC, and with Mrs. Sandy Chen Stokes started 7 or 8 years ago. I was unknown when CACC started its collaboration with City of Hope. I feel honored to be invited again by CACCC to speak in front of you like I have done it in the past. I would like to start by saying a few words about myself and the road leading to my career in palliative medicine. Why have I chosen this field, palliative medicine? About 20 years ago, I lost my father to cancer. His condition worsened after the diagnosis, not week by week, not even day by day, but from hour to hour. I jumped on the first plane to my native country, Romania, in Eastern Europe, to say goodbye to the man I owe my existence on this earth. From the moment I stepped into his hospital room, I could see, I could smell, I could feel the impending death clouding above my father's bed. But friends and family were telling my father, oh, don't worry, everything will be okay. Soon we'll go back hunting. We'll have some wine and a juicy steak, and so on. And not because they did not know that his end was near, but because the Romanian ethnic culture at that time was governed by the tendency of hiding the unpleasant truth, so that it would not demoralize or take away hope from the patient. Even though I grew up in that family and in that society, the level of deception and hiding of the truth was beyond my belief. Mind you, I came with the attitude and the training of an American physician. With all my deepest sadness, I was the one who spoke with my dad about his terminal condition, about death and dying, about resuscitation at end of life, and about last wishes. Believe me, I cried all the time while having this conversation, but at the end of it, my father shook my hand and said, I needed to hear this. Finally, someone is honest with me. I am sick and tired and beyond nauseous of being lied to. His words reassured me that I had done the right thing by telling him the truth, even though my words have upset the family and raised some eyebrows amongst his physicians. The very next night, my father took the road of no return, and he went to meet his ancestors. But he suffered in his last hours from pain, from air hunger, from fear of dying. I was by his side, tormented by the ordeal he had to go through. I did not know what to do, because in that culture, at that time, one needed to ask for pain or anxiety medication. They are not standing orders like in the United States. After that experience, I made a promise to myself that no patient of mine will ever go through what my father went through because I do not know, because of my lack of knowledge. Last year, I lost my mother to a terminal heart condition, but this time I knew how to discuss with her about end of life. I gave her permission to go and meet with her late husband and my father and tell him how we are doing. I knew how to ask for morphine and lorazepam and how to be her advocate. It was painful again, and I cried again, but I think this time was better, because this time I knew. This time I had the knowledge. Why am I still in this field of palliative medicine? Because I feel, and because I know, that I can make a difference for my patients battling cancer every day, every hour, and every minute of their lives. And because I am proud of what I'm doing. What is palliative care I am talking so much about? Some may wonder. According to World Health Organization, palliative care improves the quality of life and patients and their families facing the problem associated with life-threatening illness by prevention and relief of suffering, like Dr. Lu mentioned. Palliative care provides relief from pain and other distressing symptoms, affirms life and regards dying as a normal process, intends neither to hasten nor postpone death, and very important, I would say, it is applicable early in the course of illness, in conjunction with life-saving therapies such as chemotherapy or radiation therapy for patients with cancer. And I could say, what a difference there is today compared to only 50 years ago when palliative care was introduced in the United States. At that time, palliative care was considered as care for the dying patient. But today, palliative care is offered in hospitals, and not only in cancer hospitals, in other medical institutions, in outpatient clinics, as well as in hospices. We do not look at palliative care as a death sentence anymore. but as an extra layer of care for the patient in need. Palliative care is recommended to be initiated early rather than too late in the disease. So if you look at this slide, in blue, we have the active cancer treatments with chemotherapy, with immunotherapy, with radiation therapy. In green, we have the supportive care. So the old approach that is still quite common around the world, as well as in the United States, I would say, we have the active cancer care up to very close to the patient's moment of death. And at that moment, there is an abrupt transition to palliative care. And that's how many people perceive transition to palliative care as a death sentence. On the second model, the B1, you can see that palliative care is introduced early in the disease, and palliative care becomes more and more involved as the disease unfortunately progresses. The third model, C1, in this one, palliative care becomes more or less involved depending on the evolution of the disease. The fourth one, D model, introduces hospice that is indicated for patients with a life expectancy of 6 months or less. So again, palliative care early in the diagnosis, and then transition to hospice when the patient has 6 months or less to live. And the most modern approach to palliative care is by adding bereavement care, marked in red, in dark red, by adding bereavement care for the family who was left behind after the patient passed away. How can someone become a palliative care physician, especially here in the United States? Some of you may ask. The answer is through a rigorous 1-year residency training of teaching and caring for patients in clinics, hospitals, and hospices. Nowadays, we have almost 200 residency programs in the United States, compared to less than 100 10 years ago. There were only a handful of such residency trainings when I went through them. Those programs come with over 500 graduates each year, but we are still facing an acute shortage of physicians in this subspecialty. In an effort to address this shortage, City of Hope has opened a residency program in hospice and palliative medicine that I was entrusted to run as program director. We started this endeavor 5 years ago, and we are hoping to expand in 2025-2026. What is palliative care at City of Hope? Another question. I remember when I joined City of Hope 11 years ago, and there were only 2 physicians. Today, we are 11. We also have 7 nurse practitioners. This medical term might not be familiar for our esteemed guests from China. A nurse practitioner is a nurse who undergoes additional years of training to practice medicine independently and be a partner to, and not necessarily a subordinate to, a physician. We have outpatient clinics where we see new or established patients. We have an inpatient service where we follow patients admitted in a hospital. We have a dedicated team to the intensive care unit because palliative care is needed the most in these settings. We have a team that covers urgent consultations so that patients in dire need of our services would not wait for days or weeks to be given an appointment with the clinic. We see patients with pain, but also with other symptoms. And we also see patients in need of difficult conversations or approaching the end of their life. We can offer hospice services inpatient, but also in the City of Hope village, located right across the street from the hotel, for the patients who are too sick and unstable to be transferred home, or for the patients who do not want to die at home. What are we the palliative care team at City of Hope aspire to in the future. We want to expand. We want to expand in the community, in the City of Hope satellites, and we want to grow, and we want to improve ourselves so that we will be a proud part of the best supportive care service in the world. Thank you very much for your attention.
Thank you so much, Dr. Buga, for sharing your very personal story and your experience with the evolution of palliative care in the United States. So I'd like to introduce or have our panelists introduce themselves to kind of give a flavor of the team that it takes to provide palliative care, high quality palliative care here in the US. So we have representatives. We have a nurse practitioner, a licensed clinical social worker, and a nurse who was practicing in a hospice and created a whole organization to provide education on this topic, our very own Sandy Chen Stokes. So and then afterwards we will also be having some discussion between Dr. Buga and Dr. Lu. So Kaifan, if you wouldn't mind just starting.
Sure. Hello, everyone. My name is Kaifan. My last name is Zhao. I am a bilingual postmaster trained nurse practitioner that works for City Hope's supportive medicine department in both in and outpatient settings. I'd see any patient who is 18 or above, and mostly cancer patients. I want to piggyback what Dr. Buga earlier had mentioned, in terms of what NPs are, right? For those whom don't have a great understanding of what I do, I just want to briefly share that the minimal level of education to practice as a nurse practitioner in this country is at the master's level. Some of us are trained at postmasters or doctoral level. Much like doctors, nurse practitioners can examine patients, prescribe medications, diagnose and treat illnesses. So for instance, myself, I've been practicing palliative medicine as a clinician for about 10 years, and I'm nearing completion of training in psychiatry. Again, I can't speak nor represent all the practitioners in this country. I can only speak for myself and this team here at City Hope within this department. Should clarify that I don't work as a nurse. I'm not a scribe, not an extender. I carry my own license. I run my own clinic and make medical decisions on my own. And all right, thanks everyone.
Yeah, I do have to echo that I very much value our geriatrics and palliative care nurse practitioners. So Jenny, would you mind introducing yourself?
Everyone, my name is Jenny Lu, and I'm a medical oncology social worker here at City of Hope Duarte Medical Center. It's an honor to be part of the panelists. I have no financial or non-financial disclosure, although Dr. Lu and I have share the same last name. We're not related to the best of my knowledge. City of Hope, why am I in oncology work? To me, palliative and hospice care is part of the oncology work. And it's such a privilege to have clinical interventions with patients and family in such an intense and intimate way. And incidentally, oncology work, you will find the most compassionate providers, lifelong friends. At City of Hope, a premier cancer institution, I get to learn and work alongside giants in cancer care. I'm grateful because City of Hope was rated #1 in the West in 2019. And with that distinction, we had to grow and expand. So now we're in California, Illinois, Arizona, Georgia, and over 30 plus cancer treatment center across 4 counties in Southern California. Also, City of Hope's very committed to integrative oncology. We're developing programs which includes a lot of traditional Eastern approach to health and well-being. So what do social workers do here at City of Hope? We are encouraged to work at the top of our license, to develop programs, to be innovators. And it's such an exciting time here at City of Hope. I have colleagues in different teams, in the hematology team, the medical oncology team, the couples team, the pediatric team, and myself in the women's cancer team. We have social workers that are developing programs for young adults, for couples with brain tumor patients, and many, many others. We're also able to facilitate support groups. We have many support groups. I have the privilege of facilitating the Living with Metastatic Breast Cancer support group for City of Hope and non-City of Hope patients. We have members nationally. So as a member of the women's team, I'm really excited to develop programs under the leadership of Dr. Joanne Mortimer. We reach out to new patients even before they see our physicians. We send out support screen and we provide psychoeducation sessions to help enhance communication and coping. Incidentally, support screen is a very effective use, a pioneer by Matt Luscazo and his team. He brought it to City of Hope and he shared it with the world. And research tells us that patients will share more about themselves on an automated questionnaire than what they tell the providers. In terms of program development, I'm privileged to be part of the development of the psychosocial model of care for the unpartnered. We have an existing couples program in the women's that started at the women's team and now available for all cancer patients here at City of Hope. But the exciting thing about the unpartnered program, and you know what harder than to coping with cancer is coping with cancer alone. So I'm really proud to be part of that program and to reach out and help our patients that are unpartnered. And incidentally, in September 8th of this year, our national campaign fundraiser, Walk for Hope, the women's team name is No One Fights Alone. So won't you join us in this meaningful endeavor? Now, in terms of the support group, I get to work with giants like Dr. James Weissman, who was instrumental in starting this support group and really vested resources to this group. A couple of years ago, I was able to apply for grants and foundation funding and donor funding and organized wellness retreat for metastatic breast cancer patients. And in a couple of weeks, I will be sharing this innovative program at the Association of Oncology Social Work. Thank you.
Thank you. All right, Sandy, would you mind introducing yourself briefly?
I think at the beginning, I already introduced myself as a CACCC founder and executive director. Yes, I'm a nurse for many years, since I was 19. So I think today I will first want to thank you because this is very important. People ask me, what CACCC does, you know, what do you do? We have a volunteer, probably 90% plus are our volunteer form. And then we have all different work, can welcome everybody join us. One of my angel who's here today, it's our medical interpreter, Jing Yi. She took a time off from Stanford, came all the way to City of Hope, give a talk against the interpretation field recommended you only give an interpretation for 20 minutes, particularly as simultaneous interpretation. And is she wonderful? I mean, without her, this East meet West will probably not be able to happen. So this is one of the volunteer work our CACCC volunteer can do. And also I want to thank Dr. Buga. Actually, you answered my question since 10 years ago. I want to ask you this. When you came up to the City of Hope, our program, you gave a short talk. And I know that's a story there, a personal story that made you wanting to come meet us. And I'm so glad today I finally heard your personal story. So thank you. And I know that's Dr. Lu and Jenny and Kaifan, everybody, you all have your personal story. And I knew Emily's personal story relate to our end of life work here. So big thanks to everybody. I think I'm going to save the time back to Emily to continue our panel discussion. Thank you.
Great. So I'd like to take this moment to have our panelists share some pearls of wisdom. I know that each one of you could easily give an entire lecture related to your discipline. So today I just have a few questions I'd like to ask you. So starting with Kaifan, I heard that you started a pilot program for goals of care discussions with Mandarin speaking patients at City of Hope, and you've already seen over 100 patients. Would you mind just describing the program for us, like how it got started, how you get referrals, and how receptive patients have been to the concept of palliative medicine?
Sure. Just a quick correction, actually. No, I haven't reached 100 plus patients yet. So far, I've enrolled 30 patients. Basically, I've sort of created a pilot program since December 2023 because growing evidence shows the fact that language barriers impact quality of healthcare that certain patients receive. And I've noticed that Asian patients, particularly Mandarin and or Cantonese patients, they often don't receive the same level of care compared to other ethnic groups. But based on the data that I pulled from City of Hope, Durate main campus, roughly from February 2023 to February 2024, we had 1,557 Mandarin and or Cantonese speaking patients. Only 77 of them were seen by this team, supportive care, I guess, also known as palliative medicine. And so the number turns out to be 4.9%. So that tells us, this group is super underserved. So I guess my passion and my goal is basically I feel like, hey, I gotta do something. I gotta step up. This pilot program it's focused on again Mandarin and Cantonese speaking patients, in which they'd come to me directly for symptom management, again, goals of care discussions, code status, family meetings, whatnot, instead of being seen by a English speaking provider. And I thought it would be much easier, to have a native speaking provider like me, to manage your symptoms, in terms of palliative care. All right, thanks.
Thank you for taking the initiative to improve the care of your patients who are Mandarin and Cantonese speaking. So Jenny, a question that I had for you is, so my social work colleagues have been really helpful in providing emotional support to my patients and their families, especially when I have to break bad news. Sometimes, however, family members don't want me to disclose the diagnosis or the prognosis to the patients. How do you usually handle those situations, or what communication techniques do you use to navigate this?
Thank you, Emily. First of all, as I said, social workers here are mental health provider, your frontline mental health provider, in inpatient and outpatient services, and a comprehensive assessment, the biopsychosocial, cultural, spiritual assessment is key. In addition to all that social workers do in terms of safety, risk assessment, reducing barriers to care, supportive counseling with adjustment to medical changes, crisis intervention, facilitating, coordinating family meetings and goal of care discussions and end-of-life discussions. It is so important to assess a patient's story, culture. So as a bilingual, bicultural social worker, I have good understanding of Asian beliefs rooted in Confucius beliefs and Asian religion. Now, with any referrals where families do not want to disclose diagnosis or prognosis to a patient, as a clinician, we are mandated to assess and rule out malicious intentions, abuse, etc. But once that is ruled out, how I would approach it is sharing with the family, validating the filial piety to protect and honor the cancer patient. And usually this happens when the patient is older, adults. Incidentally, there's a movie, Farewell. And if you haven't seen it, I encourage you to see it, because that's a real true story of a writer and a producer, the director of this film. Her own grandmother was diagnosed with stage 4 lung cancer in China. And all the family members lied to grandma. And she was really struggling with the situation. And she wrote a book and made a film. How I would assess is validating the family, but it's important to provide education on the responsibility of the medical system, providers here, as well as the laws. And also provide psychoeducation, even including some of my experiences with pediatric oncology patients, how a trusting relationship really is an environment to minimize anxiety and depression. And finally, if they are still insistent, I educate on the advance directive form, because there is a section on the form that permits a patient to defer decision-making to designated decision maker. So that is a legal way for them to work around. And also encouraging that open, honest conversation. We are also responsible to educate and provide resources, even connecting them to community counseling in their primary language to process and the cancer journey trajectory.
Thank you so much for that very clear explanation of the different ways that you can approach this difficult situation.
Was I supposed to answer the second question about the bad news delivery?
Oh, no. That was just talking about myself. Yeah, when I deliver bad news, but then the family doesn't want me to deliver the bad news to the patient. So,
Okay.
yeah, but thank you.
I do have some succinct strategies for bringing bad news. In fact, I had an hour presentation with our fellows in the medical oncology, maybe for another time.
Right. Yeah. I might invite you as a grand round speaker to Harvard UCLA to give that talk.
That'd be an honor. Thank you.
All right.
There were some questions from the audience about palliative care that I hope I answered. So once again, if we look at this slide that I presented a few minutes ago, palliative care, the modern approach, in modern palliative medicine, palliative care does not necessarily represent hospice. Hospice is a part of palliative care. Another common misconception that I found, at least here in the United States, people were wondering, why is palliative care? What is palliative care? What is supportive care? Because I'm a palliative care physician, but I belong to the Department of Supportive Care. And our colleagues from MD Anderson in Houston, Texas, came with this wonderful slide that I truly like. And as you can see, you have like three circles, and the bullseye represents hospice care. Hospice care is the care for a patient with 6 months or less to live, for a patient approaching end of life. Palliative care, the second circle, is the medical care for patients with advanced disease, for patients with progressive cancer, whereas supportive care, the largest circle of them all, represents care for a patient from the moment of the diagnosis until the moment of death, including the survivorship time. Because, like I mentioned before, supportive care, like I mentioned before, we, the palliative care, the division of palliative care, we want to be part of the best supportive care in the world. And as you can see here, supportive care at City of Hope does not represent palliative care. We are just a little piece of the puzzle. You see under the umbrella how many other departments you have in supportive care. You have child life, you have clinical social work, you have integrated care service, you have integrative medicine, interventional pain, patient and family education, psychiatry, psychology, research, and so on. Patients usually, when I speak with patients and I ask them, how did you find out about our services? The patients tell me either on the internet, because information nowadays circulates very fast, or word of mouth from family, from friends who have met palliative care, or from the oncologist. Because the system that we have here at City of Hope is the integrated care model, in which the oncologist, along with supportive medicine, with the palliative care, if you want, they work together as a team. The oncologist is treating the cancer. The oncologist does what the oncologist knows the best. The oncologist treats the cancer, comes with the most advanced treatments, enrollment in clinical trials, and so on. Whereas palliative and supportive care assist with symptom control, with pain management, with nausea management, with insomnia, with you name it. And I hope I answered to all of your questions.
Yes. And so now I'd like to turn to Dr. Lu to kind of share about how your experience may be similar or different to what Dr. Buga has shared.
在中国没有严格的区分 palliative care
In
和
China,
hospice
there's no
care。
distinction between palliative care and hospice care.
目前在国家层面上只是明确了临终关怀、生命尽头照护叫安宁疗护。
And so according to the government policy right now, toward the end of July, that's what we call hospice care.
更多的 palliative care 是希望肿瘤科医生在治愈性治疗肿瘤同时关注一下患者生活质量，我们定义为人文关怀。
And so mainly is for the oncologist teams, while patients going through treatment, they can get some supportive care.
我想这和中国的医学发展阶段有关系。另外一个还有一个最大不同就是中国的医保政策、医疗保险制度和palliative care、hospice care 没有任何关系。
So the other important key point that I want to point out is because of the insurance policy in China, whether it's palliative care or hospice care, they are treated pretty much the same. There's no distinction.
那目前中国政府推动的安宁疗护叫3级联动，3级医学中心带动1、2级医院，再带动社区，是这样一个推动模式。
So basically, right now the hospice care is carry out by the top tier of the hospital and trying to bring in the second level and the third level of hospital and the community hospital to support hospice care.
那在中国呢，现在人口深度老龄化，
In China, we are facing the silver tsunami right now.
多数人生命尽头是得不到必要的安宁照护的。
Most of the people, when facing end of life, they cannot get appropriate care.
我们看到去年的数据，中国1000万人死亡，大概能得到安宁照护的，可能也不到10%。
Last year we saw about 10 million people pass in China, but probably less than 10% people can receive hospice care.
所以说，我们也希望出来走一走，作为专业人员，当政府推动的时候，我们如何让这个推动变得更为高效，能替患者发声。
As a hospice practitioner, we really like to have the opportunity to come out and learn from people, so we can bring all the knowledge back to help the hospice care and bring more quality end of life for the patient back in China.
以上是我要说的。
This is what I want to say.
And how do patients in China usually hear about palliative care and hospice?
在中国呢，他的这个病人他们是怎么听到说有这个安宁疗护这个服务呢？
这个问题特别好。其实对于患者如何发现安宁疗护，是一个，其实在我看来是个灾难性事件。
This is a wonderful question, and because I think this is a really disaster area that in China that no one really know that there is a resource there.
为什么这样说？就是我们有很多肿瘤专科医生，当患者肿瘤到晚期没有什么办法的时候，他会告诉你现在你不用做任何治疗了，你去安宁疗护吧。
Oh, so a lot of the doctors in China, oncology doctor in China, when all the treatment is not working, and they will tell the patient that just go for the hospice care.
所以说，作为安宁疗护从业者，我们一方面要接受这些转介过来的临终患者，还要告诉他，我们并不是什么也不做，我们是更积极的处理各种症状。
Because the oncology told them that because all the treatments are futile and there's nothing that we can do, and when they transfer to our unit, lots of people feel like we are not doing anything because they already been told there's nothing to be done. But in reality, when they transfer to here, we will even take better care of them to focus on their symptom management.
另外，在中国，死亡话题是个相对禁忌话题。大家想一下，死亡话题说都不能说，谈都不能谈，又如何该做呢？
Yeah, so in China, talking about death is really a taboo. So imagine if you can't even talk about it, how can you actually carry out anything for it?
所以说，在中国，不管从生死理念，还是行政法规，还是现有的医务人员理念，都需要有个大的改革。
So in reality, when we're facing death in China, it's not only the medical staff and also the government systems and also the training. We all need to have some great improvement to make it better.
以上。
Thank you.
Thank you so much for your efforts to try to change the culture in China and help make palliative care services part of the journey of patients rather than a last resort.
谢谢您。
So I just wanted to thank everybody again for attending our session today. And again, to acknowledge our sponsors.